So you have the robot that's being used by the surgeons.
Yes, we have, and we also have the only 3 Tesla magnet in the health system. And it's as Dr. Silvers was saying, you know, there's mapping programs for neurosurgical care. We do a lot of brain tumor surgery, and we map out pre-surgical. We also, with the prostate imaging, we do the same thing that he was describing.
And we're talking about, for the viewers, 3 Tesla, meaning the type of MRI.
Yes.
Very fancy equipment, very
Yes.
expensive and
Yes.
fancy equipment.
Yes, yes.
So you have that at Kings County.
Correct. And so we've really accumulated not only the equipment, but the protocols and the staff, and we're really reinventing how we're giving the care at Kings County. And if you walk into the hospital, you just feel that vibe from the first person you talk to. We try to involve housekeeping and dietary and the clerks, and everybody is a part of someone's care. They all have a role, and if you walk into a place and you feel welcomed and you can relax and you can take your anxiety away, you can actually receive better care, and that's what we're promoting.
Yeah, I you know, you and I probably have both been to many hospitals in our careers, and sometimes you get a vibe. Mm-hmm. It's like when you go to a restaurant and, you know, if the bathroom's dirty, sometimes you don't want to eat there. So
Exactly.
The same with hospitals, and
Mm-hmm.
you're what we call a chief medical officer
Yes.
of Kings County, and that doesn't mean that you're the doctor seeing every patient, but
Correct.
tell us a little bit about what the CMO, Chief Medical Officer job is in terms of quality of care and making sure that people are up to par. Tell the viewers what a CMO is. Many people probably have never heard about the type of job you have.
I can honestly say before I took the job, I really didn't know what the job was either. And so being the Chief Medical Officer is being in charge of all the clinical practices and services that are provided at the hospital. How you will provide those services and how you will have the patient experience those services. In conjunction with the CEO and the Chief Nurse Officer, the 3 of us really set policy for the hospital of how we want the care to be delivered.
So you're at the head of the medical care. Yes. So when we look at statistics and numbers, you're able to tweak the machine there to improve outcomes.
Yes.
And it's very important for patients to realize that, you know, the hospital is a machine. There are multiple parts to the machine. It's not just the nurse and the doctor. We talked a bit about social work. We talked a bit about the home care that you're able to provide. Let's talk a bit about getting into the hospital. Mm-hmm. Emergency care.
Yes.
When somebody has an emergency or they feel it's an emergency, they end up in the ER. And some patients are what we call admitted, mm-hmm. and others are discharged. For the folks who come into the hospital, we understand how that works. We talked about that a little while ago. What is the health network available to patients if they're discharged from your hospital, say with a bellyache or with an eye problem, and they're given the paperwork when they leave the hospital? What is the safety net for them? What's the next step? Is there a comprehensive care program available outside of the walls of the hospital?
Correct. So that's a great question. That type of follow-up is really what is going to close the loop. And what I mean by closing the loop is the patient's care is not finished from the emergency department until they show up at the clinic that you're sending them to. And so we're putting together a group of navigators to make sure that patients actually show up for their appointments.
Explain well, sorry to cut you off there.
Sure.
What is a navigator? We hear this at a lot of hospitals now.
Yes.
It's not someone directing the cars or the ship. Tell us what a patient navigator is.
So patient navigator is really key to modern medicine, I think, because it's very complicated, especially as a new patient, to find your way to the right floor, to find your way from the parking lot to the elevator to where you need to go. And if you can't find it, there's nobody to call. There's nobody named Steve.
You give up and go home.
Exactly.
Right.
So we're starting a program now where we're for certain patients, we will assign a navigator that somebody has a name, they have a number, and that we will follow up to make sure that they got to their appointment okay.
They leave the ER, they're given an appointment, say they scratched their eye.
Yes.
Okay, so they got poked, but there's no reason to stay in the hospital.
Correct.
So someone's able to help coordinate their follow-up so they're not lost.
Yes, and we can actually track whether they've showed up or not, especially if we think that that is something that needs to be seen within 24 or 48 hours. So we do this both electronically and with a physical person, like sort of dialing it back, going back to the Marcus Welby. But
So we spoke a little, you mentioned electronically, so medical records, the good old days of signing a note, drawing pictures on the chart of the area of the leg that we were concerned about and leaving a paper inside the folder is gone.
yes.
Everything is computerized. I access my patient's records from my phone, from my laptop. So in the ER, they're using an electronic medical record?
Yes, they are. So we're just installing a new electronic medical record throughout the corporation. It's called Epic, and it's what you'll see at most major medical centers around the country. The beauty of Epic is that your providers who are in the community also have an account, and they can access your medical record, and it's seamless. So if they see you in their office, they can send us a note, and we can actually have that continuity that we're talking about if they come to the hospital. So.
Yeah, I think that was a large problem earlier, is that you would have a blood count done in the ER, and you'd go to your doctor and say, hey, I went to the ER, and they would draw your blood again because they don't have a copy of the record. But now with what you have been installing called Epic, which is a medical record that's in the computer, patients can go from one office to the other, and all the records are together.
Yes.
So when they go to the ER and they're discharged to one of your clinics, the doctors there can review what happened there?
Correct. And some patients have their own primary care physicians who are not part of our network, and they can access the record as well through something called Epic Care Link, which is their portal into it. So if we have somebody who's coming to us for specialty services, like if they need a screening colonoscopy or if they have another issue, that provider can send us all the relevant information, and you as the provider in our hospital can actually just access it right away.
So it's not just Kings County 2.0, it's like Windows 10. It's the newest,
Right.
The top line of software available. So patients not only are getting a higher level of care like you described with Kings County 2.0, but technologically speaking, they're really 21st century plus.
Yes.
Now let's move forward into this transition of care here. Primary care. Is it available at Kings County?
Yes.
Tell us about your primary care clinics or where patients can access this.
Sure. So we have a huge number of outpatient visits. We have about 500,000 outpatient visits per year in multiple specialties, but most all of that starts in our primary care clinic. They're doing some very innovative things in that clinic in terms of being able to do what we call is like an e-referral or an e-consult. So if somebody's coming to our clinic that needs to have your services, like they have a problem swallowing or they have a problem with their digestion, we can send you a consult while they're in the office and say, what should we do with them? Should we send them to your office? Do you want to see them now? Or is this something we can just treat and let go?
So really expediting the process.
Exactly. And so by doing that, we've been able to avoid an unnecessary visit and have better access to the specialty clinics and also get more immediate care for those patients. So
very, very efficient care, starting from a primary care standpoint, which is all of our viewers need to know that Google is not the place to find the answers to your health questions. Seeing a primary care, prevention is key in healthcare. Kings County 2.0 is preventative care, primary care. Leading to the ER, you're able to admit people, maybe a safer discharge, a better discharge.
Yes.
And I really think it's incredible what's going on in the New York City landscape, and Kings County, which is part of the New York Health and Hospitals Corporation, is stepping up the game, it sounds like. Focusing back into the hospital setting, I know you have a big hospital. How many beds are in the hospital now?
So we have about 630 beds.
It's pretty big.
Yes, and we have a separate freestanding psychiatric hospital, which is about 220 beds of the 600.
You're training people?
So we're training people. We have an amazing psych program, actually. They have, over the years, been able to use lean methodology to make some of the best practices in the country. And so they have visitors coming from different states, some international, and viewing their programs.
To learn more from Kings County.
Correct. And one of their large proponents is involving the community with the care, being able to do exactly what we're saying, which is make sure that their high-risk patients are seen They have a mobile crisis unit that goes out if somebody didn't show up for an appointment. So this whole safety net, we're a safety net hospital, but we actually provide a safety net for the patients. And so,
Beyond.
yeah.
Residents, fellows,
Yes, we're
medical students.
huge training. We have training programs in almost every discipline. Some of the largest emergency medicine residency in the country. SUNY Downstate Medical School is our partner and right on our campus. We train the majority of their students. So it's a really fantastic learning environment as well.
So we're taking care of patients. You're training the future doctors. You're providing incredible comprehensive care, education. I really enjoy talking to people who provide healthcare as a safety net, as you mentioned. And for the viewers out there, a safety net means that you take everybody.
Yeah.
And you really do at Kings County. Inability to pay.
Yes.
Can't speak the language. You find someone to speak the language.
Yes.
The ER, from when I was a young kid, and I didn't even grow up in Brooklyn,
Yeah.
we've known about Kings County. This was the place where people showed up.
Mm-hmm.
And so I think that's great that you were able to come here on the show and provide us with this Kings County 2.0,
Thank
the
you.
next step in Kings County Hospital. So let's learn a little bit more about Dr. Pulitzer,
Okay.
who was before the CMO of Kings County and leading Kings County 2.0.
Yes.
You were a radiologist, correct?
Yes. So I'm a neuroradiologist. So I do a lot of MRI imaging of brain, head, neck, and spine disorders. Before I went to medical school, I was a sculptor, a professional sculptor. And so I've had a
So you were a
three-dimensional
sculptor,
career.
an artist, a radiologist, and I think that's really important because what we see more and more, the leadership of hospitals is a physician or someone who trained in patient care.
Yes.
And that's really, really important. So I think that's what's making all the difference for you. And thank you for coming on and talking to us about what is the safety net hospital of our county, Kings County, and looking forward to hearing more about Kings County 2.0. I hope you'll join us again in the future.
Will do.
Dr. Pulitzer,
Thank
really
you
thank
so
you
much.
for coming. Thank you for our interest in our show and hearing more about Kings County Hospital today. You can visit our website, medcastplus.com, and check out our tools and connect with us on social media, or reach us by phone at 718-510-2103. I'm Dr. Braha, and from all of us here at Medcast Plus, stay healthy.